Our transplant patients at Singapore General Hospital can look forward to shorter waits for transplant care. A one-stop transplant centre opened last week, which caters to patients who are preparing for or have undergone a kidney, liver or cornea transplant. The centre brings together surgeons specialising in transplant operations, doctors of other specialties, along with other health professionals like nurses. This means patients no longer have to shuttle between different clinics in order to get treatment. So to tell us more about the new centre is Dr Terence Kee. He's from the Singapore General Hospital. So Doctor, thank you very much for coming in today. Yes. So reports are saying that this is the only such integrated transplant facility in Asia. So you know what comes to mind is it's very patient focused. Was this the motivation for the idea to make it all happen?
Yeah. So transplantation is actually a quite incredibly complex field of medicine where you need to gather different healthcare professionals to see patients. And unfortunately, in the setting before we had our transplant center, our patient had to see different doctors and other healthcare professionals at different places and different time. So the transplant center was envisioned to sort of streamline the patient journey so that we bring all the healthcare professionals at one place and the patient only had to see all of them at one place.
So essentially what you did was you put yourself in the shoes of the patient, you found out what their concerns were. So what were some key considerations you took into account then?
Yes. So very early on in the project, we actually had patients to actually provide their feedback and input into the design of the transplant center. So the key concerns that the patient expressed is that they really wanted to reduce the waiting time and they really wanted to see everybody at one place. And I think the final thing is that they actually expressed for a bit more warmer and colourful ambience in the clinic setting.
Right, because you want to go to a hospital, you don't want it to be a cold place, you want it to be something that's comfortable. So you mentioned waiting time. Yes. They saved time. How much time did they save?
Yes, so we actually looked at, we actually started operations in September, clinical operations, and we have found that we have been able to reduce our waiting time of our patients by at least an hour. And we managed to do this by actually looking at streamlining some of our work processes. So for example, for the first time in our Singapore General Hospital setting, we actually have a pharmacist and a pharmacy technician who is actually in-house at the transplant center all the time. So what they do is actually they will review the prescription, confirm that the prescription is correct, and electronically confirm the supply of medicine to the pharmacist, so that by the time the patient goes to the pharmacy, all they do is just collect their bag and off they go. So they don't have to wait too long at the pharmacy.
It can take quite a long time. So many people are concerned about the rising cost of healthcare. Does it also help people to save money?
Yes. So in our transplant center, we actually have an inbuilt outpatient procedure unit. So our patients don't need to stay in hospital for certain procedures such as transplant biopsies or intravenous administration of antibiotics. So they can do all this at outpatient now, and you'll save them cost in getting admitted to hospital. Okay,
Doctor, one last question before we go. A lot of awareness needs to be made about transplants. What more do you think can be done?
Yes, so I think the important thing is that, as you know, in Singapore we have an opting out legislation. So I think as Singaporeans we should have some awareness and make an active decision about whether we want to opt out or opt into the Human Organ Transplant Act. And I think we also should be more aware that living kidney donation and living liver donation is a potential source of a transplant option for our patient.
Saves lives.
Yes.
All right, thank you very much, Doctor.
Thank you.
And that was Dr. Kee telling us more about the new transplant centre at the SGH.